So one, I know that mammograms are scary, especially for women who have never had mammograms. One thing I think it's important, especially in the age of women getting mammograms 40 and above, women tend to be taking care of everybody else, their kids, their moms, their parents, their jobs, and they just leave so little for themselves. But it is, if you could just take a little bit of time once a year to go get your screening mammogram, that could potentially save your life.
Mammogram, as already alluded, is the gold standard for breast cancer screening. Ideally, we want to find a breast cancer when we cannot feel anything on our breasts. That's the ideal situation, because by the time we feel a lump, we have changes on the skin, we have pain, usually is already farther advanced along the process. So the mammogram is the best tool we have nowadays to help us detect it without having any manifestations. And that's where we want to catch it. We want to catch it that early.
So when a patient comes to have a mammogram done, just like having a diagnostic test or imaging test in a radiology department, they're going to check in at the radiology desk and they're going to be called by a mammography technologist. They will be placed into a gown with their shirt and bra taken off only, and then the technologist will bring them into the room, go over some of their personal history as it relates to breast cancer and their risk factors of getting breast cancer, and then they will do the exam. It's typically about 4 pictures, 2 per breast, and it's about 10 seconds a picture, so it's actually quite fast.
Breast imaging is very important to women's health. Breast cancer is the first most common type of cancer and the second most common death cancer death among women. And over the past 50 years, as mammograms have been in use, the breast cancer mortality has decreased due to a combination of screening mammography and advanced chemotherapy techniques.
The recommendations currently stand that a mammogram is recommended annually starting at age 40. And I've seen in some practices that they tell the patients, oh, we're good for 2 years, no need to get it. Advocate for yourself and get your mammogram every year. Why? Because it makes a big difference. 2 years without imaging, something can be occurring and we don't even know. And again, we go back to early detection. If there's something brewing, we want to know about it. And if there's nothing wrong, then great, another year of success.